Hello, my name is Sean Sangwon Park. I'm a prosthetic urologist practicing in Seoul, South Korea. I'm currently Executive Director on Prosthetics of Korean Sexual Medicine Society. My practice has been focused on the inflatable penile prosthesis for the past decade. So today I'm going to talk about the treatment of erectile dysfunction, especially for the indication and how we have to choose the treatment options. When it comes to erectile dysfunction, treatment algorithm becomes quite different from the conventional disease, like prostate cancer or the bladder cancer. That kind of disease, goal of the treatment is life or death. So usually, we doctors give patient a diagnosis and then we give them options what to treat, but actually not real option. Patients should go through that treatment because otherwise they will end up risking their own lives. Let's say about the prostate cancer, we doctors will give a stage with the diagnosis and then we recommend the treatment, usually a surgery you should go through, and then patient end up accepting those treatments. So throughout the algorithm, patient has limited options to choose whether to get treated or not. But when it comes to the erectile dysfunction, which is a quality of life medicine field, the goal of the treatment is a patient satisfaction. Let's say patient is already diagnosed with the ED, erectile dysfunction, which is not the diagnosis done by the doctors. Actually, the diagnosis is done by the patient themselves, because the definition of the erectile dysfunction is the inability to have a satisfying intercourse 2 or 3 times out of 10 times. Doctors are not at that site to decide whether the patient has that disease or not. Patient, they themselves experience the disease and report to us that they have this kind of symptoms. Then we tell them, yes, you have erectile dysfunction. Then after that, the treatment itself, we have a limited option. It really doesn't depend on the patient's severity of the erectile dysfunction, but it really depends on patient's preference, patient's goal of the treatment, what they want. Even though patient have an ED, in the extreme case, patient might not want to get any type of treatment, or even at the slightest level of the disease, patient will want full recovery, so-called, of his status. So we doctors are not there to give them a diagnosis and the decisions, but we are there to help them to decide what they want. Treatment of the erectile dysfunction is currently roughly there are four types of treatment. The first one is Viagra or Cialis type of pills, oral pills, and then next one is injections. Trimix is one of the most popular one. The third one is a surgery, which is malleable or inflatable penile prosthesis, and the fourth one is extra shockwave therapy, which is giving them a shockwave to reverse the condition. In what patients these should be done, that should be decided by the patient themselves. Of course, each treatment options has pros and cons, and explaining it and to deliver those kind of information is job of us. And thanks to the internet, you can Google all those information about these treatment options, especially YouTube. You can check it out all thoroughly. I usually prefer a patient who is as dedicated as I am with the subject, because they already have a full information, and the thing we have to do is discuss about details or to give him a better insight with my experiences. But if you come to me and ask me, Dr. Park, what will be the best option for me? Usually my answer is that, sir, it's your own friend, it's your own lifestyle. You know what's best for you. You have to think about it before choosing what to do. General recommendation is that I usually go from the minimally invasive treatment to the maximally invasive treatment, because once you opted to get a surgery, it is irreversible treatment. Any kind of surgery is irreversible. Your anatomy will not go back once you get the surgery. So before opting to that option, it is wise to try other less invasive options. But still, if those options are not your style, you can right away go to the surgical option as well. Actually, the AUA statement recommendation, which is the American Urological Association recommendation, clearly mentions that patient can choose any type of treatment suiting on their own desires. How can a doctor can identify your own preferences with only short of a 5 or 6 minutes interview? No, we can't. But you know yourself the best. And we doctors are there to just to guide them and help them to decide a better options. So when treating ED, in summary, treatment algorithm or the way we have to approach to the treatment itself is quite different from the conventional so-called medicines. So if you come to the my practice to ask me for a decision, you're in the wrong place, because the decision of the erectile dysfunction should be on the patient. And to do so, studying and do check out the information on the internet. But not everything on the internet is precise, but as a reference point, please inform yourself as much as you can. Then consult with a trusted urologist.